When using Eligard Syringe, it's important to follow the instructions provided by your doctor or pharmacist. This medication is typically injected under the skin every 4 months, slowly releasing the medication into your blood over that period. If you're administering this medication at home, be sure to learn the proper preparation and usage instructions from your healthcare professional and the product package. You should also be aware of how to safely store and discard medical supplies. Before using the syringe, check the product for any particles or discoloration. If present, do not use the liquid. Additionally, be sure to clean the injection site with rubbing alcohol before each dose and change the injection site each time to reduce injury under the skin. It's important to inject each dose within 30 minutes of mixing. If more than 30 minutes have passed, a new syringe should be prepared. Using Eligard Syringe regularly will help you get the most benefit from it. Be sure to mark your calendar to keep track of when to receive the next dose. It's also important to note that during the first few weeks of treatment, your hormone levels may increase before they decrease. This is a normal response to the medication, and your symptoms may worsen during this time. If you have prostate cancer that has spread to the spine or caused urinary blockage, you may require closer monitoring by your doctor, especially at the beginning of treatment. Be sure to contact your doctor if you experience any bone pain, numbness/tingling/weakness of the arms/legs, blood in the urine, painful/difficult urination, unusual weakness, or inability to move. If you experience hot flashes, increased sweating, night sweats, tiredness, swelling of the ankles/feet, increased urination at night, dizziness, or mild burning/pain/bruising at the injection site, these are common side effects. Rare side effects may include shrinking of the testicles, breast tenderness/swelling, or reduced sexual interest/ability. However, many people using this medication do not experience serious side effects. Contact your doctor immediately if you experience new or worsening bone pain, easily broken bones, increased thirst/urination, or mental/mood changes. Seek medical help right away if you experience symptoms of a heart attack or stroke, seizures, fast/irregular heartbeat, severe dizziness, fainting, or signs of a serious allergic reaction. This is not a complete list of possible side effects. Contact your doctor or pharmacist if you notice any other effects. Before using Eligard Syringe, it's important to talk to your doctor or pharmacist about any allergies you may have, as well as your medical history. This medication can weaken your bones and increase your risk for bone loss if used for a long time, so it's important to discuss any risk factors for osteoporosis with your healthcare provider. Eligard Syringe may also affect your heart rhythm, so it's essential to inform your doctor about any heart problems or medications you are taking. Additionally, low levels of potassium or magnesium in the blood can increase the risk of heart rhythm issues, so it's important to discuss any related conditions with your doctor. This medication may cause dizziness, so it's important to avoid alcohol or marijuana, which can increase this effect. It's also important to inform your doctor about all the products you use before having surgery. It's important to note that Eligard Syringe can affect fertility in males and should not be used during pregnancy as it may harm an unborn baby. It's crucial to use reliable forms of non-hormonal birth control while using this medication. Additionally, breastfeeding is not recommended while using this medication. It's important to be aware of possible drug interactions with Eligard Syringe, as they could affect how your medications work or increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription, non-prescription drugs, and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Additionally, this medication may interfere with certain lab tests, potentially causing false test results. It's crucial to make sure that lab personnel and all your doctors are aware that you are using this drug. If someone has taken too much Eligard and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help by calling 911 or the local poison control center. In the U.S., residents can contact the local poison control center at 1-800-222-1222, while Canadian residents can reach out to a provincial poison control center. It's important not to share this medication with others. You may need to undergo lab and/or medical tests, such as blood testosterone level, PSA blood test, and blood glucose, while using this medication. It's important to keep all medical and lab appointments and consult your doctor for more details. Be sure to take each dose of Eligard as directed by your doctor. If you happen to miss a dose, speak to your doctor or pharmacist immediately to create a new dosing schedule. Do not take a double dose to make up for the missed one. It is important to use this medication regularly to get the most benefit from it. To help you remember, mark your calendar for the best time to take this medication. It is important to store Eligard Syringe in the refrigerator, making sure not to freeze it. If needed, the drug can be stored at room temperature in its original packaging for up to 8 weeks. Once the medication is mixed, it should be used right away. It's crucial to keep all medications away from children and pets. When it comes to disposing of Eligard Syringe, it's important not to flush it down the toilet or pour it into a drain unless specifically instructed to do so. It should be properly discarded when it is expired or no longer needed. It's best to consult with your pharmacist or local waste disposal company for proper disposal methods. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.